Matthew will be discussing the neuromodulation for pain, concussion, and recovery using the dolphin neurostimulator. After a car accident sidelined his career, Matt discovered neurofunctional techniques that transformed his recovery and inspired him to help others. He is now the founder of Body Science Therapy, Performance, and Wellness in Ontario, focusing on root cause approaches for lasting physical and mental health. I miss that part that this was you're in a car accident, that's why you have this passion. All right. That you're a better example because you experienced this and you know that it worked. And is this in Ontario, Canada? Matthew, you're in
Yes.
Canada?
Yeah, we're near Toronto. Yeah, near Toronto, Ontario, Canada.
Yeah,
Yeah.
just like
Yeah.
Bruce.
Yes. Yeah, very close. Yeah.
See, I told you we are all over right now. I'm from Delaware, Matthew. I know we first
Fantastic.
met.
Yeah.
Yes. And we
That's great.
have a short break, okay? And I know
Perfect.
you're ready, but
Yeah,
let
no
me
problem.
see.
Take your time.
We'll just take a short break, most probably 5 minutes because Matthew is here. If you want to use the loo or restroom, definitely, okay? And then we have, all right. Thank you guys. Okay, let's take a few minutes break. And definitely, this is also one of our summit. Just want to share with you. I appreciate all of you joining right now. This is a free because of our different sponsors who supported us during the Geriatric Rehab Summit. And definitely, I really want to connect with different technologies and innovators. So it's a fundraising event. So Future Foundation Global, I am the treasurer and a part of proceeds of the Global Geriatric Rehab Summit and Innovator Summit. With those helps are we partly help and assist the Future Foundation. So Future Foundation Global, founded in 2016 by Dr. Kansi and Dr. Ben Aguila as an FAU NRMF alumni organization. So I'm an alumni of the school as well. Future Foundation achieved significant advocacy milestone. As of December 31, 2022, the alumni chapter concluded giving way to Future Foundation Global. So it is a nonprofit continuing its legacy of transformative programs and advocacy. So during the Future Foundation, we have two scholars. They're doing a doctorate of physical therapy. When we go back to Philippines, we try to do some like webinars to share the different knowledge and different courses to our Philippine-based therapists. And definitely, I tried my best to share always our summits to our Philippine-based therapists so they will be able to know more. What's the updates now in US based or globally, right? So thank you guys for tuning in. And once we have our break ended, I will give the floor to Matthew. All right. Thank you. So let I lost the chat. So the previous messages and everything. All right. So attendees. Okay, so some attendees. If you have any questions, guys, definitely connect there. And I'm not sure, Tran, are you still raising your hands and want to have some questions? If ever, just put your questions here on the chat as well. All right. So in 1 minute, I will put Tin Pin.
I have a PowerPoint presentation. Should I start loading it
Yeah.
up? Yeah.
So
Okay.
you can play with it while they're getting
Okay.
ready.
Okay.
So we can see if it's doing well.
That's a good idea. Is that showing up?
Yes.
Yeah.
So
Can you
what's the
still?
time now there, Matthew?
It's 10:30 here.
10:30. Oh, we have the same time.
Same time.
Okay. Yes.
Perfect.
Mm-hmm.
Yeah, that's a good question. You have speakers from all over. I think you have someone from
Yes. Mm-hmm.
Ireland and that. Yeah,
Yeah, our speaker, Dara, is from New Ireland. They're from
fantastic.
Vertigenius. And then I have my colleagues from United Arab Emirates. I work in UAE at some point for
Uh,
5 years. I
wow.
don't see any of my colleagues in Saudi Arabia, but they are all over as well. But we have lots of physical therapists here based in US, and also lots of registrants. They're not able to come maybe live because they're aware it is recorded.
Oh yeah.
And we have also, now it's evening in Philippines,
Right.
and we have also in Vietnam. So I don't know the
Hmm.
time in Vietnam,
Wow.
guys. Dang and Tran, you're still here. I think they are almost close to Philippines because they are Asia, you know.
Okay,
So I believe so. All right.
that's
So it's
great.
10:30. Are you like 10:30 or 10:35? So I just want to be sure. But I can give you the floor so you can
Sure.
have more questions and everything.
Tran says
All right.
10:30 p.m. Thanks for sticking with us. It's
Exactly
getting
right.
close to bedtime.
See, so that's the
I
same.
like
Ah, okay. Because in Philippines, it is 11:30. They have one
Vietnam.
hour,
Oh
they
yeah. Oh,
change.
11:30. Yeah.
So now we are the same with Vietnam.
That's
I
my
only
bedtime for
change
sure.
it. Mhm.
Yeah.
We are morning and it's night in Philippines. I have my family there, so I know. Yeah.
Oh,
All
fantastic.
right. I'll give the floor to you, Matthew.
Okay, thank you. Yeah, thank you, Dr. Jenny. So, yeah, as the introduction mentioned, I won't spend too much time on my story and that kind of thing, but I will tell a bit of a story about how I got introduced to the dolphin neurostim. And if you can't hear me or have any questions, please throw it in the chat. So yeah, as the introduction mentioned, I was in a car accident after graduating from physio school. That was in 2013. I was going to try and show it, but there's a scar on my wrist here. I broke my scaphoid, had two surgeries. Conventional therapy, got me so far. And then I started to plateau. And it was around that time that I started looking for different techniques. I had been attracted to various neurofunctional techniques, techniques that involved addressing the nervous system as the root cause rather than more so looking at the muscles and bones and that in particular. I'd always had an interest in neurology. Like that's why I became a physiotherapist, was to work in stroke rehab. But then when I actually had my placements there, I realized I didn't enjoy it. But I still had this passion for the nervous system. And I really felt like that was at the root of a lot of what we're working with. So, yeah, I guess the way that I was introduced to the dolphin neurostim was kind of funny because I own our clinic, Body Science Therapy, and one of our sort of things is that we don't really use modalities in the clinic. So you're not going to come here and see the classical ultrasound and TENS machines and IFC and stuff like that. So to be honest, if I just saw the dolphin neurostim online and saw like one of these units, I probably would have just kept going. I don't know if I would have even given it a chance because we were kind of anti-modality, let's say. Um, but a friend of mine used it on me, so I sprained my ankle carrying one of my kids down a snow hill, and I sprained it in January 3 years ago, and it was still swollen after getting some treatment, and it was still swollen after maybe 2 months. And a friend of mine had learned the dolphin neurostim approach, and I thought, okay, let's give it a shot. So he used it on me, and the next day I looked at my ankle and I was shocked to see how much the swelling had gone down. I was so excited that I took a picture of my ankle and I sent it to everybody in the clinic. I wish I had a before and after picture to compare because it was remarkable. And so I shared that picture with everybody and I said, guys, like there's something to this. Like we need to learn this. So I immediately started taking their courses. And the concussion protocol is what I'm going to talk to you a bit about today. So we're not going to get too heavy into the science, but a bit of background on the dolphin neurostim. So it's a microcurrent point stimulator. It's a direct current device. So as opposed to some modalities that use alternating current, this device uses direct current, and it's a very low intensity, low frequency current. So it's not like when you use like, electroacupuncture or some of the TENS machines that are going to cause muscle stimulations and you see the muscles contracting. It's not like that. It's a lot more, it's much more gentle, but it's very precise. And it uses a frequency and an amplitude that's in the range that optimizes healing for the body. So we know that a small dose of current, so less than 1 milliamp, is going to enhance healing, promote ATP production, cell communication, blood flow, protein synthesis, all these good things. And if we go beyond that and start to get higher, we actually see the opposite effects. And this was a big eye opener for me because I had been using some of those devices for years, like, well, with electroacupuncture in particular. And then I learned that it can actually have detrimental effects on the healing process. And some of those devices can get as high as like 40 to 50 milliamps, where we want to stay less than 1 milliamp and even into the 500 microamp sort of range. So the Dolphin NeuroStim, as I mentioned, it's about 2 hertz, less than 1 milliamp. You can play with the dial here to adjust your frequency. We try to stay in the middle around the 500 microamps level. I think that's where most of the healing occurs, but we do have some room to play with it there. And the other thing that was really sort of a game changer for me with this approach was the focus on the autonomic nervous system. So, in physio school, like, we learn about it. We learn about some of the cranial nerves, and we kind of mentioned the vagus nerve is one of them. We learn about some of the sacral nerves, but really our education is focused on the brain and the spinal cord and the peripheral nerves, and which nerve causes which muscle to contract when, and what does it do, and what bone does it move, and that kind of thing. And so we had some awareness of what the autonomic nervous system was, but more so just in definition and not in terms of actual application in a practical sense of how to assess it and how to treat it and what can happen if we do assess and treat it. The way I like to look at the autonomic nervous system now is that it's like a reservoir of potential, because for so long in my practice, I've been practicing for over 10 years now. I may have been influencing it indirectly without even really knowing, but now that I'm actually looking at it, assessing it, treating it, targeting it, the outcomes are phenomenal. So here are some of the benefits of the Dolphin NeuroStim. There are all these studies listed here. You can go on the Dolphin NeuroStim website to really dig into the studies, access them there, take a good look at them. But it has very good effects on reducing pain. We see great reductions in pain even from the first visit. You can improve vagus nerve tone, heart rate variability, which we know is just so important and has actually been indicated as a measure of longevity and overall health. That's essentially our adaptability to external stimuli within the nervous system and cardiorespiratory system. One of my favorite things is the third bullet point here, releasing scar tissue. So as I mentioned, I had 2 surgeries on my wrist, and so I 100% have scar tissue here. And I'm just thinking about when my surgeon, who was absolutely incredible, phenomenal, like, he told me at the second surgery he would go in and get rid of the scar tissue, which it did seem to be that way for a moment, but then more scar tissue tends to develop with more surgeries. So I've been treating scars for about 10 years now, and this is by far the most effective technique that I've been exposed to. But a scar discussion would be a whole other presentation. We also get enhanced cellular transport. We reduce inflammation, like I said in the beginning, when I was treated with it and addressed my ankle inflammation, the effects, the reduction in inflammation by the next day was remarkable. And we can also regulate hormones, and this is a huge topic nowadays. And again, this is probably a much bigger presentation, but we know menopause is a huge discussion nowadays as well, and hormones are a big factor. And all of these are related to the autonomic nervous system. So we're not going to focus too much on the central and peripheral nervous system, but these are all linked to autonomics. As I mentioned, like as physiotherapists, we're typically not educated in a very in-depth manner on the autonomic nervous system. We are educated in an in-depth manner on the central and peripheral nervous systems, but we learn what the autonomic nervous system is, and it's kind of yeah, more just some awareness of it, but not exactly how to assess and treat it. And since I've been shifting to more of an autonomic nervous system focus, the results have been phenomenal. Like it's our kinesiologist made a joke the other day that we used to call her area in the gym the kin corner, and now she calls it the crying corner, because just about every week somebody's coming to her with a story about how much they've healed and how much we've changed their life. And we just had another one yesterday about their surgeon literally called what happened a miracle, and I don't think surgeons use that term too often in terms of a bone healing protocol. But yeah, it's just been amazing. If you can unlock the potential of the autonomic nervous system, amazing things happen. And there's also a very interesting study, I think it was done about 10 or 15 years ago, that concluded that 75 to 90% of all diseases that can related to that cause death are stress related, and the other 10 to 25% are more like trauma based. So we know that stress and ANS dysfunction is definitely affecting our health and longevity. So a few of the here's some markers from the studies that I mentioned earlier. So here's some of the benefits of microcurrent point stimulation therapy in terms of pain management. And what's interesting here is you'll notice, there's various modalities listed here, and the MPS has the greatest effect. But what's interesting here is the low back protocol tends to do the best. We're going to go through pain, heart rate variability, and some other factors. And it's actually the low back protocol that tends to rank the highest, even more than the vagal stim. And the reason for that is because if we're thinking about the autonomic nervous system, we have to think about in-depth markers related to stress, things that can contribute to sympathetic upregulation, causing parasympathetic downregulation. So if we look at the pelvis, we look at the hips, we look at the sacrum, we look at the spine, we would like all of that to be nicely aligned, like your classic traditional chiropractic philosophy or osteopathic, because the body doesn't like nerve compression, right? Like we like when nerves are compressed, cortisol is released, and the brain doesn't know necessarily why the cortisol is there. It just knows it's there, and it's going to elicit an appropriate stress response in response to the cortisol release. So if we can normalize, if we can create some symmetry in the hips, the piriformis, the sacrum, the spine, decrease nerve compression, we get all these amazing influences on the autonomic nervous system, and which include pain here. And we can see on the next slide, ATP enhancement, which is just incredible, like 400 to 700% improvements in ATP production. And this is one of the reasons why people come in for treatment and they're like, oh my God, I can't believe how fast I'm healing. Like even post-surgery, like very quick rates of healing, like fracture healing. Like it's really, really amazing. I believe the next one is on HRV. And so, yeah, then the effect on HRV is just amazing as well. And again, we see the low back protocol at the top, and that's just because of what I mentioned earlier. If we can create some more balance in the autonomic nervous system, then things are going to function better. We're going to put the body in more of a healing state where it can do what it's designed to do. We just need to give it a little nudge and help it be in that healing state and keep everything nice and aligned. And just a little side note, I used to wonder, like, do we need to be doing things like vagal stim? Do we need to be doing these treatments? Like, aren't our bodies smart enough and designed to heal on their own? And I think the answer is yes, they are, but it's hard in just the way that our environment is designed right now. We have things, I'm not trying to fear monger, but like working against us, like there's things like pollutants in the air, the water, the food that create stress in our body. There's emotional stress that we don't have the necessarily appropriate tools to work through. And then we have the physical stressors like scars and sacral misalignments and jaw misalignments and nerve compression. And so I think it's really important to look deeply into these types of therapies that address the autonomic nervous system, because it's kind of hard when we have all these things working against us. So these are the primary applications. There's several of them. First, we have the pain management. So you can see a picture here of someone applying the Dolphin NeuroStim to acupuncture points along the spine called shoe points. And depending on what protocol you're looking at, what the patient's complaint is, you'll apply the MPS into different areas of the spine here. That's similar to what you would see with like a low back treatment, except obviously it would be a little lower. Um, then we have the scar release. We could do a whole other presentation just on scars. It's phenomenal how much scars impact the autonomic nervous system and can contribute to things like autoimmune diseases. And I say that with confidence because I've seen resolution of some by treating scars. And then the vagal stim, which is great as well. And you can see here, the lady in the picture has the vagal stim clipped onto her ears. So I often recommend my patients buy the unit so they can use it at home. Some of them are surprised because it means probably less visits to come see me, but I think that the outcomes are just that much better if they can do the therapy at home and stimulate the vagus nerve directly after we've resolved some of the issues that are down-regulating the parasympathetic system. Then it's time to stimulate the vagal nerve and try to boost it back up. These are some of my favorite applications. So we have the sensory balancing. This is another one that people can use at home. I know this reference is probably going to be outdated soon, if not already, but I feel like Gumby after doing the sensory balancing protocol, putting a pad on the neck and the feet as you see in the picture there. So what's happening there is we have the pad on the feet. It's essentially applied to one of the acupuncture points at the feet, kidney 1, and then the microcurrent is running up through the body to the neck and it's circulating back through. And this is an incredible treatment for peripheral neuropathy, which is probably a bigger problem than we might realize. And again, people can do it at home, which they just love. The pelvic floor portion, I'm just getting introduced to that myself, but even that being said, I've treated some of my wife's pelvic floor issues through doing actually the same protocol that I'm going to explain later today for the concussion protocol. And my wife had been going to a very good pelvic floor therapist. She used to work at our clinic, very highly trained, very reputable, in high demand. And her symptoms would fluctuate. They were definitely better, but they would kind of go up and down. I did the protocol and some of the pain management points, the protocol that I'll explain later, and the pain management points, and it just knocked it out, gone. Even with many sorts of aggravating factors. No, it did start to creep back a little bit later, but I think that's because after you do the therapy, you do need to like strengthen the muscles and sort of rebuild strength in tissues that had been compromised for some time. But it was, it was amazing. And then we have the concussion and brain recovery. I could tell many stories about that, but I'm just going to tell one today. And that's what we're going to get into in a few minutes. So yeah, as I mentioned, I own a clinic called Body Science Therapy, Performance and Wellness. I've always been interested in the brain and root cause healing. I didn't like what I saw in some clinics when I first graduated from physio school in 2013, where it felt like patients were just coming to the clinic to do exercises and get put on machines, and I didn't see the value in it, to be honest, and I was a little turned off from it. And again, that's why if I had seen this device just online or something, I probably would have passed it right by, because I'd say, no, I'm not that type of therapist. But no, it's a very deep rooted root cause approach. So this is a picture of our group here. Our kinesiologist is hiding in the back there. She's the one she says she works in the crying corner because she helps me out with treatments, and we just see some amazing things. But we generally treat orthopedic conditions. We do treat concussions, which I'll talk a bit about. Pelvic floor is something that's gaining popularity within the clinic. We now have a clinician training in pelvic floor therapy. We do get some neuro cases as well. It's mainly because of the type of treatment we do, though. Like, we're not necessarily like neurophysiotherapists who are trained in necessarily like stroke rehab techniques. So we always encourage people to continue with those outpatient clinics. But when they come to see us, their effects of treatment are enhanced, and they do get better faster. And in general, we get the difficult to treat cases. It's pretty much every week we're hearing you're my last hope and that kind of stuff. And It's amazing when you can actually give those people hope. We just heard that story again yesterday too. So the day my practice changed was when I had the ankle sprain and was treated with the dolphin neurostim and saw the effects and was just amazed at them. And that was one example of when my practice changed. And I started taking the intro course and learning the basics of pain management. And then I took the concussion course and I was talking with a friend of mine. So I play hockey a few times a week. And I was talking to one of the guys I sit with in the dressing room, and he was talking about his daughter who had a concussion 2 years ago. Actually, she had 5 concussions within 2 years. And at this point, when we were talking, it had been 2 years of her going through different therapies. And sorry, I'm going to try not to get emotional with lots of different therapies, and she just wasn't getting better. And I said, okay, I'll give it a shot. Like, let's take a stab at it. So her main symptoms were, the classics, the headaches, dizziness, vertigo. The dizziness, vertigo was a big one. It was, I would probably say, debilitating. Light and sound sensitivity was really affecting her quality of life. Her and her dad are big hockey fans. They had a tradition where they would go to the Toronto Maple Leaf games every year together, and they couldn't anymore because of the concussion symptoms and the sensitivity. So that was definitely affecting her quality of life. She's a teacher, and so she had to take a year off work, so she wasn't working, wasn't doing the meaningful things in her life, and it was really impacting her. So there's always the mental emotional component of post-concussion syndrome. She had cervical issues, as you see listed below, hypertonic C-spine, restricted C-spine joints, and then the fatigue as well. So upon examination, we found some of those things. The VOMs and the VOR, like the concussion testing, increased her symptoms. The Buffalo concussion treadmill test was positive. So that's where we put them on the treadmill and see if that stimulates more symptoms, which it did. So based on this assessment, the plan was, okay, let's target her cerebrovascular system. So, she's going to do the sub-threshold exercise training, which means when we do the Buffalo concussion treadmill test, if your symptoms come on at a certain heart rate, then you train at 80% of that heart rate to allow your system to accommodate and acclimatize to it. But it wasn't working. Treating her neck, as I'll get into, helped the headaches, but her dizziness was actually getting worse. And sometimes she would come for treatments. I'm not talking about dolphin neurostim, I'm talking about other treatments we were doing. Sometimes she would come for treatments and she'd feel worse for like 3 days, a week after. And we were doing some eye retraining as well. So the first goal was to get her back to work. So we tried all these things. We were trained in complete concussion management. She had so we were doing physiotherapy, chiropractic, massage, electroacupuncture, different muscle testing techniques to treat receptor dysfunctions. She had been to a naturopath. She had tried functional neurology. I'm not sure exactly what that meant in her case. I think sometimes it's a lot of different eye movements and nerve stimulations. And I put the money up here just because so her dad and I still play hockey together, and when I see him and we sort of reminisce about this, he always mentions the money. He mentions that he just shakes his head, like she spent so much money over that time, those few years leading up to our treatment with the dolphin. I think I listed about everything there. We tried some vestibular techniques. The cerebral means the cerebrovascular blood flow. And then we got the psychological. So she had tried a lot of different approaches. And in physio school, we don't get a ton of education on concussions, at least when I was in there. It was which was 2011 to 2013. I think we essentially had like an afternoon lecture on what a concussion is and, refer to an MD sort of thing. So as I mentioned, she was getting treatment at our clinic, seeing myself, our chiropractor, our massage therapist, and the headaches were getting better. But overall, the recovery was kind of up and down. Some symptoms were still very bad, particularly the vestibular symptoms. She was telling me, I remember at one treatment, she said she just moved a rug as they were rearranging furniture in her house, and that was it. That set her off, like vestibular issues for days. Sometimes she would get dizziness, aggravation from our treatments. So I thought, okay, I got to try something different because this isn't working. I just completed the Dolphin Neurostim concussion seminar, which is focused on targeting the autonomic nervous system to improve brain healing. And there's all these different points that you see listed here. We're not going to really get into all of them, but it's just here for awareness. And one stage of the protocol is to treat the liver. So I thought, all right, let's give it a shot. Like, I'm not sort of prejudiced to any treatment technique. It's just got to work. I thought, let's try this liver cooling and balancing thing. You see the liver balancing points listed in the picture here. So when they explain this step in the course, they explain how in Chinese medicine, there's different elements involved, right? There's 5 elements. We have fire, earth, metal, water, wood, and they all are related to different organs and systems and things like that. And we have different ways to stimulate them through the body using, well, traditionally acupuncture, but we can stimulate them using the dolphin microcurrent. So the approach here is focused on the liver, and if the liver gets too hot, the liver's wood, and if it gets too hot, it heats up the heart. And in Chinese medicine, the heart is essentially the center for cognitive processing and decision making, and what we would typically think of as like the brain functions. And I remember actually, as I was preparing for this presentation, that I had done a project on ancient Egypt when I was in like grade 2 or something. And I remember them saying the same thing, that the heart was actually valued more than the brain. And to the point where when they're doing mummifications, they take the brain out and they actually might take the heart out and mummify it and then put it back in because it was so much more valued. I remember thinking that was so strange at the time, but it stuck with me. So that's essentially the thought process here, that the liver heats up the heart and the heart is the way to the brain. So I applied the liver cooling and brain healing protocols, and immediately the dizziness improved. And I thought, that's very strange. I didn't even touch her head, right? Or neck. In fact, when we did, it made it worse. So I did the liver cooling, the dizziness improved. So I thought, let's keep going. So I kept going with the brain healing protocols. We did the sagittal suture along the top of the head. We did jing points, which are points in the fingers and toes. We did auricular. There's battlefield acupuncture in the ear, and something called a nervous system reset. Then the patient comes back, I think it was a few days or a week later. She said that night she did feel tender on the top of her head. She kind of felt like things were changing. And then in her words, she woke up the next day feeling perfectly fine. And I thought, this is wild. Okay, let's keep going. So then we did more sutures. There's several major sutures in the head to treat. We treated the hips and back. So as I mentioned earlier in the presentation, if we do the protocol that addresses the hips and back, it really helps to balance the nervous system. So this just enhanced things more. So we treated the hips and back for her concussion, which I never, ever, ever would have considered in all my training. And then she said, headwise, I'm feeling good. The approach is working. So we were getting real results. And we actually ended up working on other stuff, just like a rib that would go out from time to time or that kind of thing. And this is what really struck home for me. That's a picture of Courtney and her dad. Her dad's the guy I play hockey with. And he came over to me in the dressing room and he said, I just got to thank you. And I said, why? He said, you gave me my daughter back. And that was like a really moving moment for me. Guys don't usually talk that way to each other, let alone in the hockey dressing room. So he really meant it, and he still seems thankful to this day. So this is a picture of them after all the treatment and after she was recovered from the concussion, and this is them at a Toronto Maple Leafs game together, so they could go back to their yearly traditions of going to the games together. So it not only, and that's when I also realized, like, it wasn't when we're treating people, it's not only about them. Like, there's a bigger effect that happens too, because now his quality of life is restored as well. He can have that father-daughter time back. So it was just a really big impact that I'm really grateful to be a part of. And then this was amazing too. I get chills. Like, so Courtney was here a few weeks ago doing a testimonial with us, which I mean Dr. Bruce and his team will have available shortly. But we have a whole video of Courtney and I sitting down together, reminiscing about this whole process. And I didn't know this until 2 weeks ago, but she actually didn't she wouldn't start a family. She couldn't start a family until the concussion was resolved. And it wasn't until that we treated her and she got back to normal that she was ready to start that part of her life. And I I never knew that. And that was just such an amazing thing. So her family plans, life plans were paused. And after the concussion therapy, she now is conceived, and that's her baby there. There's a picture of them in the clinic when she came to do the testimonial, her husband Ryan, her baby Wesley. And oh, there's something I was going to say, but I feel like a little off track talking about that. So it's just been a really amazing experience, and her quality of life has been changed drastically. And so this was a huge experience for me, and I just thought I would take the time to share. Oh, that was the other thing. When as I was telling this story to our team, I kind of had my head down, just focusing, recalling information, whatever. And I looked up, and a bunch of them had tears just rolling down their face because they had seen Courtney and her baby that day, but they didn't understand all of the connection and the process and what went into it. So yeah, so that's all I have to say based on the presentation. But I'm an open book. I'll do my best to answer any questions that there are. If not, I can throw my information in the chat, and I'm more than happy to either connect you guys with Dr. Bruce and the Center for Pain and Stress Research, or answer questions myself. So thank you for taking the time to listen.
My pleasure. So we have you until 11:20. So if you want to add more information, feel free. But guys, if we can go back, Matthew, on one of the slide of
Yeah,
the you're trying to
which one?
increase. There's a graphic of
Oh,
increasing the ATP.
mm-hmm.
Yeah, the benefits of the MPS therapy, or is it the point
Yeah, MPS
stimulator?
microcurrent point stimulator. Yeah.
Okay, microcurrent points. So there is an ATP enhancement, and
Mm-hmm.
then there's also an increase in HRV. Can
Right.
you emphasize why it's important? What is ATP first, the adenosine
Got
triphosphate?
it.
Why it's important, and why it's important to enhance those both
Yeah, that's a
for
great
us? Yeah.
question.
Thank you. Mhm.
Yeah, no problem. So as you mentioned, the ATP, the adenosine triphosphate. I mean, if we think back to maybe undergrad for many of us and some postgrad stuff, that's essentially like the energy in the body, and we need the ATP to, break apart into the ADP to help stimulate the energy production cycle, which is required for healing. Right. So if we don't have enough ATP production, then healing will be delayed, or yeah, just kind of slower. And more ATP is going to lead to faster healing and better healing. And I think probably just even better overall vitality.
Mhm.
Um, and then the HRV is something that seems to be talked about more and more. So that's heart rate variability. So the heart rate variability is the ability of our heart rate to adapt to, or sorry, our
Mhm.
cardiovascular nervous system to adapt to different stimuli. So we don't want to look at a heart rate and see that it's just the same heart rate all the time. It should vary a little bit based on what we're doing, right? So for example, when we're performing some exercise, we want to see that when we stop the exercise, our system can adapt and kind of calm down and come back to a baseline. You might also think of it as like a homeostatic response or
Mhm.
a system through the body.
Yeah, so that's really cool because I'm not always focusing on that, We just know more
Yeah.
on like the better heart rate, but we, especially in cardiac rehab, they are
Mm,
very focusing on increasing that heart rate for the max heart rate, and then,
yeah.
but it is really good to know that the MPS or microcurrent point stimulator
Hmm.
therapy affects that itself. And now we need to
Yeah.
focus that the higher the heart rate variability, the greater the stress, and the resilience they have.
Right.
And yeah, it's like
Yeah.
another, although we know heart rate already as a
Yeah.
vital sign, but it can
Right.
add as another like a vital sign
Yeah.
indicator for us.
It's
Yeah.
almost like a functional application of a vital sign or something like that. Like it's a very good measure of your overall, yeah, like adaptability. And I've done some protocols. I treat a couple of athletes, professional, semi-professional, and I've seen it too, where when we're doing this regularly, they recover so fast when they're training. Like they don't get as much of the muscle soreness. They can progress their exercises faster. Like the adaptability of the nervous system just, as you see, yeah, greatly improves. So yeah.
So when we have Matthew, when we got the dolphin neurostimulator,
Mhm.
we have also like a book with all the different points
Yeah.
or neuro.
Yeah,
Yeah,
it comes
because
with
I
a few
remember
different
this.
books. Yeah, so it comes with a video about how to set it up and apply it. And then it comes with different books with protocols. So there's one book with like protocols for ankle pain, neck pain, headaches, menstrual
Mhm.
cramps. The menstrual cramps protocol is so effective. Amazing. I've done it
Menstrual.
on yeah, we have some like younger girls working at the front desk, and
Mhm.
some of them told me about the bad menstrual cramps they get, and I've done it. We're two for two on resolving them, and it generally lasted about 3 months. But like two of them said they had brutal cramps where they'd be bent over in pain and that kind of thing, and gone. So it's there's so many applications for this technique.
Mhm.
It's yeah.
Yeah, you have many applications, right? But in your
Hmm.
practice, what's the level of your application? Is it more on scar, concussion,
Mm.
or like and then a little bit one. I got already this wonderful story. I can picture it already. We always have lots of wins,
Yeah.
right? But we always have like a particular that we always share. But with
Yeah.
all those stories that you have, like how you categorize like these are majority are scar. You said you're learning more on the pelvic, but how about your clinic?
Yeah.
What's your
Yeah.
average?
So it's mostly the funny thing is pretty much like no matter what someone comes in with, I'm like hunting for scars to treat first.
Mm.
So the scars are so influential on our nervous system. We can see very big decreases in cortisol levels after treating scars. We
Oh,
see
okay.
immediate changes in fascial tension. And the amazing thing is the widespread effect through the body. So not only through, hormonally through cortisol, but you can see it electrically. I mean, see it electrically is a funny way to put it, but you see like muscles get stronger within the session. You see fascial tension releasing, and you can palpate that through a few areas in the body, like the shins and head. And so the ironic thing, and I don't know if it's ironic, but like when if somebody comes in with a concussion, I might actually look for scars in their body first because the scar tension from, let's say, a C-section is gonna like pull if my shirt is the scar, it kind of pulls on the fascia. Sorry, if my shirt is the fascia, the
Mhm.
scar pulls on the fascia and can pull all the way up to the head. So old traumas can create current tension in areas like the head and neck, and then you add a concussion onto that, and it's just compounded. So sometimes, actually, most times, I'll actually go for the scars first to start relieving tension, help to balance the autonomic nervous system because scars will add more stress and put you in this sympathetic response, just that response at like
Mhm.
baseline. Start to balance it out, and then start going through like the liver cooling and the sutures in the ear and stuff like that. So the scar treatments have been phenomenal. I mean, if you want, I can just go through more stories, but if you have any other questions, I can do that too.
Yeah, this is new to me, especially the liver cooling term. Like the heart is the fire.
Mm,
I just know that heart is like a muscle, very
yeah.
muscle organ that we need to strengthen.
Right.
I explained to them that's why aerobic strengthening, aerobic
Hmm.
stamina, conditioning. But
Yeah.
you have a certain language, that
Mm,
liver, that we will
good
learn
point.
more on the when we learn more on dry needling and acupuncture. You mix it
Hmm.
because as
Yeah.
you talk about the fascia itself, and
Yeah.
if people will learn more about the fascia itself, once you have, it's like anatomy train. We're treating like
Yes.
the patient comes because he has a knee problem,
Yeah.
but as a therapist, automatically you will treat the knee. But if you learn more about this because you
Yeah.
have more background, I think you're also a chiropractor. I see. Is
Oh,
it?
I'm a physiotherapist, but
Ah,
whatever.
okay,
Yeah.
okay. Ito ay DC. Na I saw a DC. But
Oh, okay.
when you learn more about this as a background, you're
Yeah.
very seeing them holistically, deeper
Yes.
dive.
Yes. Yeah.
That like what you
Yeah.
said, you're looking for a scar, but they came from a
Yeah.
concussion. That's now
Yeah.
how you deal, which is
Yeah.
really interesting, which is good.
Yeah. Yeah. And the
And
nice thing was, sorry, did you want to add something?
yeah, yeah, yeah. Go
Because
ahead. Mm-hmm.
like I had, as I mentioned, like I had been practicing a lot of different techniques before the dolphin neurostip, and that was because of the injury to my hand. So I had been exposed to techniques that clearly showed that if I treat somebody's ankle, like their hip can get better, or these, and maybe even further reaching sometimes. So I was already seeing those sort of effects, not to this scale, but I had seen it. So when the dolphin neurostim was introduced to me, and it's a concept of like, oh, I can treat a scar on someone's elbow and their core strength can get better. Like that was not so far fetched for me. I was all in on that. I think the challenge sometimes is when you meet a patient for the first time who isn't familiar with this way of thinking and maybe wasn't referred by a colleague or a friend, and they just kind of come in off the street, and I'm like, hey, I know you came in here for your concussion, but I want to treat that scar on your shin. And they might be like, hold on, let's back up a little bit. But the results are there, and to this point we get so many friends and family referrals because of what we're doing, that most people just come in and they're like, hey, I heard what you guys are doing is great, just do your thing, like do whatever you want. So in those cases it's great because they already have a trust with us and we already can just jump into this very holistic approach.
Mm-hmm.
And to your point, you're absolutely right. I think one of the challenges probably for new practitioners is getting comfortable with the language of, like a liver meridian, and then the philosophy of like the liver can affect the heart, and like, wait, we're treating the heart for like cognition and stuff like that, right? Um, but yeah, I mean, it's got to work, right?
Yeah, and this is a lot to talk about because you just specify just in one slide you have more than five benefits of that. And
Right.
this is
Yeah.
only a one tool. This is just a small one tool, but there's lots of benefits. And if we
Yeah.
as a physical therapist add it on as another tool in our
Yeah.
toolbox, this is really amazing because I
Yeah.
always try different courses. I always emphasize this in my course summits. Like I'm an educator, physical therapist, but I always emphasize to new clinicians, students, and new therapists that we need to invest in
Yeah.
ourselves. That's
Yeah.
why I always attend courses. I am an advocator of educational summits and
For
made it
sure.
affordable to different countries or globally because
Amazing.
once we learn more,
Yeah.
like now I'm learning
Yeah.
from you. I'm always listening to all the speaker. I'm learning from you. Then once I learn something, I applied it to my patients, right?
Yeah.
So
Yeah.
who are
Absolutely.
who are the beneficiaries? Our patients.
Yeah. Yeah. And their families, right? Yeah.
Exactly. And
Yeah.
then a
Yeah.
good win for us because they appreciate that and then
Hmm.
are we're just going home with another win. And then
Yeah.
sometimes it affects us when we cannot really see how can I treat Mrs. Smith?
Yeah.
Like
Yeah.
you always thinking how can I help her more, which is really very good
Absolutely.
that we have this thing. Thank
Like
you so much,
yeah,
Matthew.
no problem. No problem. And thanks for hosting this, Dr. Jenny. I really appreciate
My pleasure.
it.
Please try to put your information there,
Yeah.
Matthew,
Absolutely.
on the chat as well. And then definitely they will connect with you. And I appreciate you joining us live from Canada. I
Yeah,
told to Bruce that I was in Victoria at one point and Vancouver. Never been in Ontario though. But definitely guys, if you have more questions to Matthew, connect with him and you can ask more. Then they can definitely connect. And then if you have any questions about the dolphin stimulator, connect with me and I can check with Dr. Bruce and Matthew, all those connect with you with the team and Hetvi. All right. Thank you
perfect.
so much, Matthew. And we
Thank
have
you.
also we learn from you. We appreciate great learning every day, you know.
Awesome. I'm
Any closing remarks, Matt?
I thank you for having me. I'm an open book. I've been so moved by this therapy. I have more stories to share. So if you want to do, if anybody has questions, if you want to do another chat, I'm more than happy to do it. And yeah, just happy to help try to change the world in any way I can.
Yeah, I'll definitely invite you with a podcast so we can
Oh
chat
yeah,
more and then your
fantastic.
stories too. I
Okay, sounds
appreciate
great.
you. Thank
Thank you.
you.
Thank you. Thank you,
My
everyone. Bye.
pleasure. All right. So